The tragic deaths of Rob and Michele Reiner are all over the news, and death by the hand of their own son leaves many of us questioning who would do something like this. Hello and welcome to the Dr. Suzette Glasner Podcast. Don't forget to hit like and subscribe to my YouTube channel if you haven't already so that I can continue to bring you content on addiction and mental health science and treatment. The tragic deaths of Rob and Michele Reiner are all over the news, as all of you know. And the image of the unthinkable death by the hand of their own son, Nick Reiner, leaves many of us questioning who would do something like this. How could someone brutally murder their own parents, especially in light of all that they've weathered as a family? Nick had a long-standing history of addiction. He went through multiple treatment episodes. His addiction was so severe that at least one point it led to homelessness for him. This family has been through a lot. And ultimately, a positive outgrowth of his addiction was a father and son collaboration on Being Charlie, a film that was co-written by Nick and someone he went through treatment for addiction with, about their experiences, and directed by his father, Rob, all about their family dynamics as they struggled through his addiction and recovery. And from all that I've read, that was noted, at least by Rob, as a growth experience and an experience that brought them closer. I'm going to cover this case in greater depth when there's more known about the circumstances surrounding the murders in terms of Nick's mental state and his addiction. We know that he was in recovery 10 plus years ago, and he had achieved stable recovery for a period of time. That's all called into question now, but we don't really have much information about what was the status of his addiction and what was going on specifically with his mental health at the time of the murders. But for now, my analysis is going to focus on what we know about child-to-parent violence. That's a thing that has been studied in the research literature. It's not the easiest to study, and I'll talk about why that is. But Nick's profile suggests that he has pretty much all of the risk factors for violent behavior towards an adult parent. So I'm going to start with violent behavior, and then I'm going to move to homicidal behavior and how that relates to drug use and mental health. But first, I just want to talk about how common is violence against parents by adult children. Now, definitionally, when you become an adult child, your parents are usually older, right? So when we talk about violence by adult children, it's usually towards elderly parents, and estimating how frequently that occurs can be very challenging. And I wonder if this was not the first episode of violence between Nick and his parents for two reasons. The first is, one of the main reasons it's really hard to characterize and to study how frequently violence by adult child perpetrators towards their parents occurs is because of the parental bond. It prevents the reporting of violence. So parents feel a strong sense of love and responsibility, often an obligation to protect their children despite their violent behavior. So they also can have these sort of complicated emotions of feeling shame around the way that their children are behaving towards them, fear of negative repercussions. For some parents, there's a fear of cutting off contact with grandchildren. That wasn't the case with Nick. Or even just cut off communication between their child and themselves if they report them and stir up more conflict. And they just often feel guilty all around, like maybe somehow they have contributed to or they're at fault somehow for their child's behavior. So that's one reason that has me wondering whether violence had erupted between Nick and his parents before. The other reason is that according to news reports, it was Nick's sister who suggested to the authorities that they investigate Nick as a potential suspect or perpetrator, which then later led to his arrest. So I wonder if that was based solely on certain bizarre behavior or concerning behavior that she saw from him, or whether there was a history in this regard that made her fear that he would have committed such a heinous and violent act towards both of them. So the research we do have shows that nearly 6% of elderly parents, like the Reiners, have been physically abused by their adult children. And that estimate jumps up higher when you're talking about adult children who have severe mental illnesses like schizophrenia. So in one study, the estimate jumps up to around 25% of parents of adult children with schizophrenia who have experienced child-to-parent violence in the past. So Nick is described as having mental illness, but we don't know the nature of it. So what I want to review with you next is some of the risk factors for child-to-parent violence among adult children of elderly parents because the profile is eerily similar to what we know so far about Nick. So perpetrators are typically sons, not daughters. They are usually in their 30s or 40s. Nick is 32. They're more likely to be single, which he is to my knowledge. About 1/3 are unemployed. I don't know Nick's employment status, but I have the impression he may not be working. They often experience poor health, including both physical and psychological problems. And the most frequent psychological problems that are observed among these individuals who are perpetrators of violence towards their parents are schizophrenia, depression, autism, and ADHD. Now, which, if any of these, he was experiencing, we don't know, but those details will be coming to light in the coming days and weeks. Misusing alcohol is also associated with violent behavior towards parents specifically, and drug use and or addiction are also predictive of violent behavior. So we know he has a history of all of that. Which of those things characterize his active behavior in these recent days, we're still waiting to learn more about. But another factor that I think it's important for parents who may be feeling fearful of their children with mental health and or addiction issues should know is that the perpetrator's co-residence with their parents is also a factor. Now, this isn't to say that no one should live with their adult child if they have problems, because for many reasons, other arrangements may not be feasible for most people. And also, most people cannot expect that something this extreme and severe is going to happen to them as victims of their adult child, at least something as severe as homicide, because the base rate of homicide towards one's parents is quite low. So this is not a high frequency event. But for parents who experience violence from their adult children, the perpetrator's co-residence with parents is a factor. So living with your parents is a risk factor. And the reason for that is because conflicts are just more likely to occur under those circumstances. So it's just one factor to consider when you're looking out for your own safety and trying to manage a family member who may have a mental illness or a substance use issue and also has some of these other risk factors and or a history of violent behavior towards their parents. So now those research statistics were all about violent behavior. They were not specifically about homicidal behavior. So now I want to shift gears and talk a little bit about that. There's actually a term, most people probably don't know this, but there is a term for homicidal behavior towards one or both of one's parents. So killing one or both of one's parents is known as parricide. And because it's what we would refer to as a low base rate phenomenon, like the frequency of this happening in the general population is very low, that makes it very difficult to study. Some estimate that it's 1% to 2% of all homicides. The estimates vary in different countries. But we can talk about matricide for a moment. That's the killing of mothers by their biological children. That's a pretty rare event, comprising less than 2% of all homicides in the United States in which the relationship to the offender is known. So it's a very small subset of homicides. What we understand about matricides is that most mothers are killed not by daughters, but by their adult sons. That's one piece of data that we've seen pretty consistently in the studies that have been done. And then when we talk more broadly about parricides, which is killing one or the other or both of one's parents, here are the circumstances under which studies have found them most frequently to occur. And these all also match up with our knowledge currently of the Reiner case. Parricide is usually committed in the victim's house. We know that's what happened in their Brentwood home. Perpetrators often reside with the victim, and according to reports, he was living in and out of their home in Brentwood. So it wasn't necessarily his permanent residence, but there was something in the vein of him living there on and off that was going on. And the perpetrators frequently use painful methods and excessive violence in committing the murder, which sadly we know to have been the case in the fatal stabbing of his parents, with some graphic description implying that it was quite violent in the way that he did it, allegedly. The most common mental health diagnosis among perpetrators is schizophrenia. And for those of you who don't know too much about schizophrenia is a psychotic disorder. And psychosis is when you lose touch with reality. So you're seeing things that aren't real or that aren't really there. You're hearing voices of people who aren't really there. In more severe forms of schizophrenia, people can experience what are referred to as auditory command hallucinations, where a voice is telling you to do certain things or commanding you to do certain things, which can or cannot be violent. But that's the most common scenario in terms of mental health. Did Nick have, or does Nick have, schizophrenia and psychosis? We don't know, but we do know that one substance that reportedly he historically used as part of his addiction, which is methamphetamine, is something that can cause and is strongly associated psychotic symptoms and psychotic behavior as well as violence. So if he was actively using drugs, and among those drugs at the time of the homicides was stimulants, particularly methamphetamine, which he does have a history of, that could somewhat explain the possibility of him having experienced psychosis. But all of that remains to be confirmed, and we're awaiting those types of details from the case. Among people with schizophrenia, matricide, or killing of the mom, occurs more than patricide. And then after schizophrenia, the most common diagnoses that have been observed in people who commit parricide, or murder of one or the other or both of their parents, is depression, as well as substance use disorders or addiction. We know he had that addiction history. We know he had some mental health history, but we don't know the specific nature of it. But these are all very consistent with the typical profile of individuals who commit these types of acts. The estimates range from 15 to 23% if you just look in the general community of people who have used methamphetamine in the past year. But when you go to an addiction treatment setting and you survey people with a methamphetamine addiction in those settings, up to 60% of them have experienced psychotic symptoms or a break with reality. And there have been a series of studies around violence as an outcome of use of amphetamine type stimulants like methamphetamine. And we know that the odds of violent behavior in the context of methamphetamine use more than double compared to people who don't use methamphetamine. So I know that Nick also had a history of opioid addiction. That's not so clearly and consistently related to violent behavior as what we see with stimulants. But as we receive more details about this case, I will come back to you to help you better understand how his psychological state, the substances that he was using, and his mental health status might be somewhat explanatory in this case. It's always hard to wrap your head around, as I said, the unthinkable. And murdering not one, but both of one's parents is truly unimaginable and hard for most of us to relate to or understand. I think it does bring up questions for a lot of people who have addicted loved ones in their families. Should they be worried about this? Is there something the Reiners should have done differently? It's very difficult to say because this is a pretty rare case. As I mentioned, the base rate of parricide is relatively low, so this isn't a high frequency event, but we're hearing all about it in the media, which makes it feel like it probably happens more than it does. Is violence in the context of drug use and mental illness of concern? Sure, it is, particularly if somebody has a history of violence and some of these risk factors that I've described. But I would say, as a parent of a child with an addiction or a mental health issue, you have to really trust your gut about safety. If you don't feel safe around your child, then that's something to really pay attention to. And some of the more dangerous mental health symptoms and substance use disorder symptoms are the ones that are untreated. So when in doubt, if somebody you're close to not only has these issues and their behavior is making you feel unsafe in some way, but those issues are untreated, that's a time to think really seriously about getting them plugged into some kind of care, potentially not cohabitating with them until they're more stable. But for most of us, this is much more complex than that. And the factors that weigh into a decision about whether or not to live with an adult child with a mental health issue or a substance use issue are complex. So having a trusted professional who you can consult about this, who you can run your concerns by as they relate to safety or potential violence, can be very helpful, and I highly recommend it. Stay tuned for more on this case, and thank you for listening. I look forward to seeing you next time.